Hey everyone, I want to talk to you today about allergies, hay fever, spring seasonal kind of itchy eyes, itchy nose, sneezing all the time, miserable type of allergies. If you're new to my channel, my name is Dr. Michael Corsilis. I'm a naturopathic doctor practicing primary care and functional medicine. I'm also a physician assistant. So, when it comes to allergies, I want to talk to you about treatment for sure, because I know you're itching, literally itching to know what you can do to get some relief. But I also want to talk about signs and symptoms and some things to prevent these allergies. So I see allergies a lot. When it comes to allergies, it can be just seasonal. Most often it's in spring and summertime. But for some unfortunate folks, it can be all year round. What's the difference between seasonal allergies, hay fever, just straight up allergies, or COVID-19 or an infection, cold symptoms? Sometimes you can have similar symptoms, like you can have runny nose, plugged up nose, you can have sneezing, coughing, but with an infection, you're most often going to have fever, chills, body aches, sore throat, cough, could be a really productive cough. You tend not to have the itch. When it comes to the itch, that's the itchy eyes, itchy nose, a lot of sneezing. That's with the allergies. Because related to those allergies is histamine. Our body makes histamine, and our body just gets overzealous and creates too much histamine in response to a lot of like environmental allergens, whether that's dust, pollens, foods. But most often when it comes to spring and summertime, it's that hay fever kind of stuff. So trees, plants, grasses, weeds, all the pollens that are coming into your body. The body's like, whoa, what's this stuff? And it releases all this histamine. Now our body uses histamine, needs histamine. Histamine, people don't realize it's like in our nasal passages and all that, but it's also throughout our body. It's in our brain. Histamine's also in our gastrointestinal tract, so we need that stuff. There are some folks with some histamine intolerance, and excessive histamine can actually contribute to like anxiety and depression. Histamine actually acts as a neurotransmitter. We also have histamine in the gastrointestinal tract, so some folks will also have a lot of upset stomach, bloating, and then when it comes to the brain, so you can also have migraines when it comes to too much histamine. Now, what to do about this excessive histamine? So for a lot of treatments, I'll recommend some natural treatments, things to prevent it, and even over-the-counter medications. Yep, there's a lot of folks who are just suffering so badly, I'll prescribe straight-up medications. To be honest, it works really well. And it's fine to do it short-term, like if it's just seasonal. So when it comes to natural treatment options, often I'll recommend we got to try to minimize those pollens from getting all over you, so you minimize histamine from being released. So a lot of times I'll recommend a HEPA filter, HEPA. A lot of homes already have a HEPA filter in place, but there are portable HEPA filters you can have. And I do like the pure HEPA filters. Those are the ones that you have to replace every few months. The filters that you have to rinse off and those kind of things, they really don't filter as much compared to a true HEPA filter. So you can get those portable ones and run it right beside your bed. You can run it beside your desk at work or whichever room you want. So that'll help to minimize dust and a lot of the environmental allergens. The other thing too is when you're outside, you're getting that pollen in your system or on your face. So when you're indoors, it actually helps just to wash your face right when you get indoors. And it helps to change your outfit because you're going to have those pollens on you too. And if you do have those pollens on you, you're going to go to bed, it's going to get on your sheets. So I recommend washing your sheets often, like once a week in high heat. You always also want to minimize too much histamines in foods. So there's a lot of foods that trigger too much histamine or accumulate histamine. So a lot of the foods we tend to like can cause too much histamine. So for example, wheat, certain meats, coffee, leftovers, all of those things can cause too much histamine in the body. And that can cause classic hay fever stuff or some of the other symptoms, non-kind of hay fever symptoms I talked about. And when it comes to treatments, things you can buy and take, the natural treatments, common ones, a lot of the supplements, you'll notice if you Google like allergy supplements, they're going to have things like vitamin C, quercetin, nettles, and a bunch of other ones, but those are big ones right there. Those three can work good. I like vitamin C because it also helps the immune system, but it also is a mast cell stabilizer. Mast cells are part of the immune system, so they house all that histamine in the body. But when the mast cells rupture, like if you got like all these allergens, the body says we need to release histamine. Those mast cells rupture. Vitamin C will stabilize those mast cells so they don't rupture as easily. So that's one thing. But to be honest, often those treatments are not enough for my bad allergy sufferers. They're like, I already tried the natural stuff. But I'm like, you can do that on top of the over-the-counter medications. So now when it comes to the over-the-counter medications, you have a few options. A lot of people are like, well, I do it, but I get super sleepy. So I want to talk to you about the drowsy or classic histamine, antihistamine, is Benadryl or diphenhydramine. So Benadryl is notorious for making you sleepy. So I have a lot of folks like, just take it at nighttime. You know, especially if your allergies are bad, take it at nighttime because it makes you sleepy. You're just gonna sleep. But you also can couple that with an over-the-counter antihistamine that's a non-drowsy one that you can take in the daytime. So those are things like Claritin, Zyrtec, and Allegra. So you got the non-drowsy, and then you got the drowsy one, which is the Benadryl class. And it's okay if your allergies are really bad to do both. One non-drowsy in the daytime, and then a drowsy one like Benadryl in the evening time. And then you can do the natural supplements on top of that if you're still not getting relief. Now there are some folks who will add anything from like a nasal spray. There's various nasal sprays, anything from like a saline spray. So it's a neti pot where you put in a little teapot here, you put saline and it irrigates and cleans all that junk out of there. There's saline in just spray form. And there's also there's this saline spray I like is called Clear, X-L-E-A-R, that contains xylitol. Xylitol is also that X, that's why it's spelled X-L-E-A-R. But xylitol spray actually helps get all that junk to get flow and get out of the system. There's also over-the-counter nasal sprays. There's one Flonase. So Flonase is a steroid, so it's not an antihistamine, but that steroid will help inflammation, but also help with the itch. Now, Flonase works well, but you just have to give it time. It can take a few days to finally kick in, so don't give up after one day. So you got to give it 3 or 4 days to finally work, and you can take that throughout the whole allergy season, but it is meant to take on a daily basis. Now, for itchy eyes, there are some over-the-counter eye drops that you can use. So not just like natural tears, but a specific antihistamine eye drop form. So those are over-the-counter too. So there's a lot of those over-the-counters you can use in conjunction with the natural ones. So there's prescription versions. We have to go to the doctor's office and get something prescribed. But to be honest, a lot of the over-the-counters work really well. The last thing is there's some folks who are the allergies are so bad, they've tried everything. They have to actually go on a couple antihistamines or even 3 antihistamines to get it a little bit under control. Those folks will actually do immunotherapy, which is basically doing allergy shots on a regular basis. So you're giving yourself small doses of that allergen to build up immunity, which can take up to a year, sometimes even more. But you go to an allergist for that. So when patients see me and I'm like, man, I've tried all these other treatments, I'll finally refer them to an allergist to do allergy testing and possibly those allergy immunotherapy shots, so you become immune to those allergies. So those are just a few of some things to help treat some allergies. Hopefully that gives you some relief. If you still need extra help, shoot me in the comments any of your questions in the comment section below. Well, I think that's covers about everything when it comes to allergies. I'm sure there's a lot more. I'm just not thinking of any right now, but that should cover a bunch of them, and that should give you some relief. So I hope you enjoyed this video, and I will talk to you guys next time.